Hey everyone, welcome back to the channel. If you're new here, I'm your name. And today we've got something seriously exciting to talk about. We're diving into the world of medicine, not the boring textbook kind, but real, life-changing treatments you need to know about. In this video, I'll be sharing 10 breakthrough drugs that aren't just making headlines. They're literally changing the future of healthcare. From curing deadly viruses to helping babies with rare genetic disorders, these are the meds that are rewriting what's possible. So grab a coffee, hit that like button, and let's get into it. Let's start with a big one, Harvoni. Now, hepatitis C used to be a chronic, often deadly disease. It attacks the liver, and for decades treatments were long, harsh, and not always effective. That changed with Harvoni. This wonder drug combines two powerful ingredients, ledapaspvir and sofosbuvir, working together to stop the virus from multiplying. The results? An almost unheard of cure rate of 94% to 99%. That's right, cure rates. And get this, it's a 1-pill-a-day treatment that can clear the virus in as little as 8 to 24 weeks. It's especially effective against genotype 1, the most common strain in the US+. It's approved for kids, adults, people with HIV, and even liver transplant patients. Now, here's the catch. It's pricey, around $1,100 a pill. But when you weigh that against a lifetime of medical costs and suffering, many say it's worth every penny. A game changer. Let's talk about Evrysdi, also known by its generic name risdiplam. This one's for spinal muscular atrophy, or SMA, a genetic disease that affects motor neurons and makes it hard for people to move, swallow, and even breathe. For years, SMA treatments required injections into the spine or hospital visits. But Evrysdi changes everything. It's a liquid medicine you take at home once a day. It works by boosting the production of the SMN protein, which is crucial for muscle strength and movement. In clinical trials like the Firefish study, 90% of infants survived without permanent ventilation after 12 months. Another trial, Sunfish, showed real improvements in motor function in older children and adults too. It's a breakthrough for rare disease care, safer, easier, and more accessible for families everywhere. Now this next one is incredible, Hemgenix. It's a gene therapy for hemophilia B, a rare bleeding disorder where your blood doesn't clot properly. Up until recently, patients needed regular infusions of clotting factor IX to prevent dangerous bleeds. But Hemgenix is a one-time infusion that delivers a working copy of the F9 gene directly into liver cells. In trials, factor IX levels increased significantly, and bleeding episodes were cut by 64%. It's already approved in the US and parts of Europe, and it's changing lives. Imagine moving from constant hospital visits and risks to near-normal bleeding control with a single treatment. Researchers are still tracking long-term outcomes, but this one's looking like a total game changer. Alright, this next one's a surprise. You might know Dupixent, or Dupilumab, as a treatment for asthma or eczema, but researchers are discovering it might also help with keloids, those tough, raised scars that can itch, hurt, and grow over time. In recent case studies, patients with severe stubborn keloids saw big improvements with Dupixent. Take this one case, a 23-year-old woman with large keloids on her shoulders. Steroid injections didn't work, but once she started Dupixent, the pain and itching eased and the keloids stopped growing. Another patient dealing with keloids from acne saw fewer new scars and less discomfort too. Clinical trials are still underway, but it's exciting. If it works, Dupixent could become a much-needed option for a tough-to-treat condition. Trikafta might be one of the biggest medical stories of the last decade. It's a triple combination therapy for cystic fibrosis, a genetic disease that makes mucus in the lungs thick and sticky, leading to breathing problems and infections. Trikafta fixes the defective CFTR protein, improving how salt and water move in and out of cells. What that means for patients is better breathing, more energy, and longer life expectancy. People often notice the difference within days: clearer lungs, less coughing, and a lot more freedom. Take Jenny Livingston, who lived with hospital stays and declining health for years. After starting Trikafta, she stabilized, started exercising, and now makes plans for the future with her daughter. It's not a cure, but it's close. Alzheimer's is one of the toughest diseases out there. It slowly robs people of their memories, independence, and personality. Lecanemab, developed by Biogen and Eisai, is one of the first drugs proven to actually slow the disease's progression. It targets sticky clumps of protein in the brain called amyloid plaques, which are believed to cause cognitive decline. In studies, patients receiving lecanemab had slower memory loss and better thinking skills than those who didn't. It's not a cure, and it's not perfect. But for families and caregivers, even a small delay can mean more good years together. And right now, that's huge. Scemblix is a next-gen drug for chronic myeloid leukemia, a type of blood cancer. It targets a rogue protein called BCR-ABL1 that drives the disease. Older treatments work too, but Scemblix has been shown to be more effective and easier to tolerate. In the ASC4 first study, newly diagnosed patients had better response rates and fewer side effects compared to older drugs. This matters because better tolerated treatments mean patients stick with them longer, leading to better outcomes. If there's a drug that feels like pure science fiction, it's Zolgensma. It's a one-time gene therapy for spinal muscular atrophy in babies under 2. SMA weakens muscles and can be deadly within months. Zolgensma delivers a healthy copy of the SMN1 gene, replacing the faulty one. In trials, babies who got Zolgensma sat up, crawled, and even walked. Milestones once thought impossible. Twins Kaylee and Caden, diagnosed with SMA type 1, received Zolgensma as infants. Today, they're thriving, sitting, standing, and even dancing. It's life-saving, life-changing, and a testament to what gene therapy can do. And finally, Keytruda, or Pembrolizumab. It's an immunotherapy used to treat several cancers, and recently it's made a huge impact in kidney cancer, specifically clear cell renal cell carcinoma. It works by blocking a protein called PD-1, which cancers use to hide from the immune system. Once blocked, the immune system can attack the cancer. In a major study called Keynote 564, patients who took Keytruda after surgery had a 40% lower risk of death compared to those on a placebo. 4 years later, 91% of Keytruda patients were still alive. Incredible news for a cancer that often comes back. So there you have it. 10 breakthrough drugs that are literally reshaping medicine and giving people a second chance at life. From curing hepatitis to treating genetic diseases once thought untreatable, these meds show just how far science has come. Which one blew your mind the most? Drop it in the comments below. And hey, if you enjoyed this, give it a like, subscribe for more, and share it with someone who'd find it interesting too. Thanks for watching. And I'll see you in the next one.